am Dr. Suvarchalaa, Scientific Director with ZIVA Fertility Centers. A happy Deepavali to everyone. With an intention to spread brightness in our patients' lives, ZIVA Fertility Centers is offering IUI in a package. Usually when we talk about IUI, the cost goes up because of consultations, scans, medications, and also the IUI procedure per se. The same things are being offered in this IUI package at a price of 14,990 now. The numbers that you see on the screen are our appointment lines. Please book a slot. Thank you. Hi, I am Dr. Suvarchalaa, Scientific Director with ZIVA Fertility Centers. Infertility in both men and women can be caused by various factors, and this topic for today discusses the types of female and male infertility, focusing on the common causes and underlying mechanisms. We'll first begin with types of female infertility, and in that, ovulatory disorders require precedence because issues with ovulatory account for 25 to 30% of female infertility cases. This includes irregular or absent ovulation, which is called as anovulation, which affects egg release. Polycystic ovarian syndrome is one of the causes. Hormonal imbalances leading to irregular ovulation is what happens in polycystic ovarian syndrome. Early depletion of ovarian follicles occurs due to premature ovarian failure. That can be another cause. Disruption in the hormones that control ovulation, which are caused by hypothalamic dysfunction, can also be a cause of female infertility. Then there are tubal factor infertility reasons that we should talk about. Blockages or damage to the fallopian tubes prevents the egg and the sperm from meeting. Pelvic inflammatory disease is one of the most common causes, often due to infections like chlamydia or gonorrhea. Endometriosis is also an issue where endometrial tissue growing outside the uterus leads to scarring of the tubes, which leads to infertility. Tubal surgery or ectopic pregnancy is also a common cause. Damage from surgery or prior pregnancies can also cause infertility. Uterine and cervical disorders also should be discussed because structural issues with the uterus or cervix can interfere with embryo implantation or sperm entry. Uterine fibroids or polyps can cause this. These are benign growths in the uterine lining. Congenital abnormalities can also cause infertility. These are structural defects like a uterine septum, which divides the uterus into two parts. Cervical mucus issues are also a problem. Mucus that is too thick doesn't allow sperms to travel inside the uterus. Endometriosis is also a condition that causes infertility depending on its severity, of course. This is a condition where tissue similar to the lining of the uterus grows outside the uterus and it causes inflammation and scarring. This can impact or affect the ovaries, fallopian tubes and pelvic cavity, reducing fertility. Unexplained infertility is also a very worrisome cause. In some cases, no specific cause of infertility can be identified despite thorough testing. This accounts for around 10 to 20% of cases. It could be due to subtle, undetectable issues like egg quality, sperm interaction, or endometrial receptivity. So these are the most common causes of female infertility. Let's discuss the types of male infertility. We'll begin with sperm production disorders. Problems with sperm production, quality or quantity, are the most common causes of male infertility. They can be caused due to oligozoospermia, which is low sperm count, azoospermia, where there is no sperm production, or teratozoospermia, which is abnormal sperm morphology present in the sperms. Asthenozoospermia is where the sperm motility is very low. Then a common cause of male infertility is also varicocele. These are enlarged veins in the scrotum which can raise the temperature and affect sperm production. One of the most common causes of male infertility, varicocele, can affect sperm quality and quantity. Ejaculatory disorders are also a cause of infertility in males. Issues that are related with sperm delivery during ejaculation are included in these. Ejaculatory disorders include retrograde ejaculation. This is a condition where sperm flows back into the bladder instead of out through the penis. The erectile dysfunction is also included in this. Difficulty achieving or maintaining during intercourse and erection can prevent proper ejaculation. Hormonal imbalances also cause male infertility. Hormonal disorders that disrupt the production of testosterone and other hormones essential for sperm production cause male infertility. That includes hypogonadism, where reduced function of the testis leads to low testosterone levels. Pituitary disorders can also cause male infertility because problems in the pituitary gland that control reproductive hormones can be affected by this. Genetic disorders are also an issue. Genetic abnormalities that affect sperm production or function can cause infertility. For example, Klinefelter syndrome. This is a genetic condition where males have an extra X chromosome that affects sperm production. Y chromosome microdeletions are also common. Missing section of the Y chromosome that affects sperm production can lead to severe or mild sperm factor infertility. Unexplained male infertility is also a cause, because in some cases no specific reason for male infertility is found despite normal semen analysis. This could be due to issues with sperm function, DNA fragmentation, or factors not detectable by standard tests. So both male and female infertility can be caused by a range of issues, from ovulatory disorders to tubal problems in women to sperm production and hormonal imbalances in men. Identifying the specific type and cause is essential for treatment and for determining the best options that are available. To understand more about this, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.